News. Welcome back to Washington Journal. I'm joined now by Josh Golin. He's the executive director of Fair Play. We're going to be talking about that Surgeon General warning about social media and youth mental health. Josh, welcome to the program.
Thanks so much for having me.
So start just by talking about Fair Play, what the mission is, and how you guys are funded.
Sure. So Fair Play's mission is to build a world where kids can be kids, free from the harmful manipulations of big tech and the false promises of marketers. So what we do in practice is we do a lot of work to try and make it safer for kids online, and also to make it less addictive for kids online so they can get the offline activities that they need in order to thrive. We are funded entirely by individual donations and by foundations. We do not take any money from the tech industry or any corporation.
And if any of our viewers would like to weigh in, ask a question of our guests, you can do so. Our lines this time are by region. So if you're in the Eastern or Central time zone, you can call 202-748-8000. If you're in Mountain or Pacific, it's 202-748-8001. We also have a line set aside for parents and caregivers. You can call us on 202-748-8002. Well, take a look. I'm just going to show the New York Times article here about that, which says Surgeon General warns that social media may harm children and adolescents. The report by Dr. Vivek Murthy cited a profound risk of harm to adolescent mental health and urged families to set limits and governments to set tougher standards for use. And we'll just put it on the screen, kind of an overview of what those findings were. And it says this, so this is from the Surgeon General, that social media may perpetuate body dissatisfaction, disordered eating behaviors, social comparison, low self-esteem. 46% of adolescents aged 13 to 17 said that social media makes them feel worse about their body image. 64% of adolescents are often or sometimes exposed to hate-based content. And some social media platforms show suicide and self-harm related content. And that's from the hhs.gov, if you'd like to see that. Well, I mean, break that down for us, Josh. Talk a little bit about what's going on here and what the major findings were.
Sure. So first, I'd just like to say that I think that this report from the Surgeon General has the potential to be a game changer. One of the things that we've seen in our advocacy to try and make social media safer in these last several years is that the tech industry likes to deny the research. They're working from the same playbook as big tobacco and the fossil fuel industry, and any doubt that they can cast on the research, they will do so. So to have a medical official with so much prestige and expertise like the Surgeon General saying unequivocally that the research shows that there is significant harms and risks that come with social media really has the opportunity to move the conversation forward, so we're no longer just talking about the problems but talking about the solutions, which is what we need to be doing. But in terms of what's in the report and some of the findings, I think some of the most concerning things that the Surgeon General documented is that teens who spend 3 or more hours on social media have double the risk of mental health problems like anxiety and depression. Now you might think, well, 3 hours, that's a lot. Who spends 3 hours? Well, the average amount of time that teens are spending on social media every day is 3.5 hours. So the average amount that teens are spending is going to more than double your risk of mental health problems. And, mental health problems are just some of the risks that young people face online. Cyberbullying, more than half of teens say that they have been cyberbullied. Cyberbullied is linked to all sorts of mental health problems and an increase in suicidal ideation and suicidal attempts. Young people report that they frequently have unwanted contact from adults. 25% of kids 9 to 17 say that they have had an explicit sexual interaction with someone that they believe is an adult. And then there's other things that come, harmful content that is recommended to kids. So, you know, one of the things that we know is that if you create an account on TikTok and say that you're a 14-year-old girl, and then you you know, indicate in some way that you are depressed or struggling with your mental health, you will start getting videos recommended to you by TikTok that talk about how you can do self-harm without your parents knowing. If you express any dissatisfaction with your body or look for tips on healthy eating, you will be barraged with content on how to have an eating disorder without your parents knowing. Viral challenges are also recommended to children that encourage them to partake in all sorts of dangerous behaviors. The choking challenge alone has killed hundreds of children in the United States who have attempted it just because they want to go viral and be popular. So we are talking about some of the most serious...
What's the choking challenge? What was that?
Oh, sure. So the choking challenge is a viral challenge that appears on all the major social media sites, where kids are encouraged to film themselves asphyxiating themselves so that they pass out, because you can make a really funny video that gives you a chance of like getting a lot of likes and shares and going viral. But of course, something like this is incredibly dangerous, and hundreds of kids have accidentally killed themselves attempting this challenge, and yet it still appears everywhere on all the social media sites.
Well, you mentioned eating disorders, and your organization put out a report about that and Instagram. Can you tell us what you found?
Sure. What we found is that there are 90,000 unique accounts on Instagram that are promoting eating disorders that are viewed by more than 20 million young people on Instagram. So that this pro-eating disorder content is getting out very, very widely, is pushed very widely by Instagram. And in fact, the reason that it's pushed so widely is because Instagram is making hundreds of millions of dollars from the accounts that are following these pro-eating disorders. So there's this bubble of pro-eating disorder accounts where kids are being force-fed this material that encourages them to have an eating disorder, that glamorizes having eating disorders, and Meta is actually profiting from this.
Well, another issue is privacy. What kind of data are these big tech companies collecting on kids?
They are collecting just about every kind of data on kids. So everything that we do online, every post that we like, every video that we watch, every video that we hover over and even consider watching is recorded by these platforms. But it's not just what we're doing on their platforms. They're tracking us when we visit other sites. They're combining that with offline data that they have about things like our parents' income or where we live and how we're traveling around the world and all the locations that we visit. And they're using that data in order to target advertising that is most likely to be effective on children, and to target children with the content that is most likely to keep them on a platform longer. So one of the things that is so harmful to children about social media is this business model, which is design your platform in order to keep kids on your platform as long as possible, so that you can collect as much data as possible, so you can use that data to target advertising to children, but also target the content that is most likely to keep them on longer. So you have this cycle where the more kids are on there, the more the platforms are doing to keep them on even longer, and that exposes them both to extremely harmful content, and it keeps them online too long and prevents them from doing things that they need to be doing, like their homework, sleeping, physical exercise, and interacting face-to-face with caring adults and their peers. And
speaking of amount of time spent online, take a look at here's from the article itself, from the report at hhs.gov. By the way, you can read that online. It's about 19 pages long. But it says this: up to 95% of youth ages 13 to 17 report using a social media platform, with more than a third saying they use social media, quote, almost constantly. That's a lot of time spent online. So let's talk about, Josh, what Congress is doing and what the legislation that might be out there, the proposals that might be out there that would limit and regulate social media use for children.
Sure. So there are two bills currently in Congress that my organization is extremely excited about, and we are working with advocates and parents and public health officials around the country to build support for this legislation. One bill is called the Kids Online Safety Act. And what this bill, it would do a number of things, but I think probably the most important thing that it would do is it would create a duty of care for these companies to identify and prevent and mitigate the most serious harms to children online that result as a result of the way that these platforms are designed and operated. So, creating a duty of care to prevent eating disorders and self-harm and suicide, and also patterns of compulsive use. So if you're designing your platform in a way that's causing addiction in kids, that would not be okay if this law passed. And this is incredibly important because right now, the only duty that these companies have is to their shareholders. And the way that they make more money is by getting kids to be online even longer by any means necessary. They don't care what kind of content they show to kids to keep them on longer. So often it's extremely harmful. So this law would create this duty of care, which would force these companies to evaluate, are the features that we're using to keep kids online longer, are those actually safe for children? We believe that that would be an incredible game changer. But that's not all that the law would do. It also creates more tools for parents so they can understand what their children are doing online and help their children set the settings and keep them safer. It gives kids themselves more tools to protect themselves. And it also gives researchers access to the algorithms that these companies are doing so we can better understand how these platforms operate and what they are actually doing to our children. Right now, the only people who understand these algorithms are the people who operate within these companies. And so these transparency requirements will go a long way in holding these companies accountable and forcing them to build their platforms in a safer way. I mentioned that there's another bill, and that's an update to the Children's Online Privacy and Protection Act. The only bill that we have that protects children online right now was passed in 1998. It's a children's privacy law. It's a good law, but it was passed before we had things like smartphones and social media, so it needs to be updated. And that bill only covers kids up until their 12th birthday, their 13th birthday. So we need to get teens privacy protections, and that's what this law would do. It would also ban data-driven advertising to kids and teens. And that is so important because, first of all, data-driven advertising can be incredibly harmful to kids in and of themselves. It allows advertisers to target kids at their most vulnerable moments and target their individual vulnerabilities. And in fact, a few years ago, Facebook was caught bragging to advertisers how they could target kids at the exact moment that they were feeling bad about themselves and feeling bad about their bodies. So we don't want advertisers to be able to target kids' vulnerabilities like that, so that's important. But the other effect that this law would have is that it would cut off the data flows that are used in order to hook our kids and to addict them and to serve them that toxic content. We need to limit the data that is collected on our kids because that is the fuel that is used to run these harmful algorithms.
And what are Josh, the challenges of legislating social media use and the enforcement of it?
Well, I think the biggest challenge is getting legislation passed because the tech industry is incredibly powerful, has deep pockets, and it has its lobbyists all over Washington right now trying to defeat this legislation because they want to do business as usual because there is a huge amount of money to be made off of children. So this is really a question for lawmakers. Are they going to side with big tech and continue business as usual and, kids literally dying every day on social media? Or are we going to create some guardrails and some safety mechanisms, just like we have for every other product? Are we going to make these products safer, I think is the big question for lawmakers. In terms of challenges of regulating, really what we need is resources for regulators. I think the biggest challenge is that the Federal Trade Commission, which is charged with regulating these companies right now, doesn't have enough resources, and so they may have to make really hard decisions about which companies and which features to go after and try and prosecute. We need a fully resourced Federal Trade Commission to keep up with these companies that are moving at the speed of light and changing the way their platforms are designed, and it's very hard for regulators to keep pace with that.
All right. Well, Josh, let's talk to some of our viewers. Greg is first up in Fayetteville, North Carolina. Good morning.
Yeah, good morning. I'm a high school teacher, and it seems like schools are having a hard time coming up with a cell phone policy that works. If you ban the cell phones, that doesn't seem to work. The parents want their kids to have it. If you give them limited cell phone access, none of that works either. And the kids, if you try to talk to the kids about social media and cell phone addiction, they just kind of roll their eyes at you because they think you're just an old person in another generation. My question is, how can we talk to the kids and help them realize themselves that it's not a healthy situation, and also address it with the parents who are allowing their kids to have cell phones at such a young age, and also seem to be part of the problem?
All right. What do you think, Josh?
Yeah, that's a great question, Greg, and I don't envy being a teacher in this age and, trying to teach to students who have phones and are, while you're trying to teach them, have access to the world's biggest arcade and the world's biggest porn collection and the world's biggest music collection, and can talk to each other, surreptitiously while you're trying to teach and trying to get their attention. I can't imagine what that's like. But in terms of what we can do with students, first of all, I do think schools should ban cell phones during the day. And I think that that's going to take a lot of parent education, because I think parents get nervous about the idea that they can't contact their kids during the day. But you know what? A lot of us were raised and never talked to our parents during the school day and turned out just fine. And so I think, working with parents around that anxiety of not being able to reach their kids is something that schools can do. But in terms of talking to the students directly, I highly recommend that schools show the film The Social Dilemma. It's on Netflix. It's one of the most watched documentaries in Netflix's history. And what that film really does is break down the ways in which these platforms are designed in order to addict us. And to take away our autonomy, so that it makes it much easier for us to just keep mindlessly scrolling rather than to break away and do the things that perhaps we would actually prefer to do. And one of the reasons why I recommend that movie is, first of all, it's incredibly well done, but second of all, teens hate the idea that adults are manipulating them. And so I think one of the things that we can do with teens is to teach them about all of the ways that these platforms are deliberately trying to manipulate them for profit in ways that goes against their best interests. I think that can be helpful. But having said that, I don't think we're going to educate our way out of this problem. We need regulations that change the way that these platforms operate, because it's just not a fair fight using the most powerful technologies ever developed in order to addict kids and then ask kids to try and resist that all on their own.
And here's a quote from the Surgeon General's report on their advisory for parents and caregivers. It says this, that parents can make plans in their household, such as establishing tech-free zones that help protect sleep and better foster in-person relationships, teach children and adolescents about responsible online behavior and model that behavior, and report problematic content and activity. Let's talk to Ed next in Ocean City, New Jersey. Hi, Ed.
Hey, Ed O'Donnell. What I stressed with my nieces and with all young people, spend your life loving, helping people, charity work, and physical fitness. And if young people feel really good physically, the ocean, the pool, whirlpool, sauna, steam, sports, they're not going to need this addiction. Do you see what I mean?
What do you think, Josh? Any comments there?
Yeah, I think it's really important that we help kids find alternatives to being online, and I think being out on nature and sports and being outside are some of the most important experiences that kids can get, and absolutely social media and the time spent online is completely interfering with that. And I would agree with the caller that if we give kids those opportunities, they frequently will log off of social media and look for other things. But it can take some work to get them there, and so we need to really help them find those opportunities.
All right, and we will be taking your calls for the next 20 minutes or so on this topic. If you'd like to call in, you can do so on our lines by region. So if you're in the Eastern or Central time zones, 202-748-8000. If you're in the Mountain or Pacific, it's 202-748-8001. And if you're a parent or a caregiver, you can call us on a line set aside for you. That is 202-748-8002. Todd is in Moreno Valley, California. Good morning.
How are you? I just wanted to say, if parents would use filtering software and, teach their kids what right and wrong is, we wouldn't have the need for dangerous bills such as COSA or the Earn It Act or age verification, which is nothing more than an attempt to infringe on everyone's rights, including adults. As a kid, I didn't do dangerous, stupid dares, so it's up to the parents to teach their kids. It's not up to the government.
What do you think of that, Josh?
Yeah, I understand what the caller's perspective, but I don't agree. I mean, parents are overwhelmed right now. What they are facing is different than any other generation of parents before. This is not something where kids are spending 15 minutes a day on social media. We're talking about, in many cases, the majority of their waking hours. There is no parent that has the time and the technical savvy to monitor all of that time. And the platforms actually make it much harder for parents to understand what's going online. They deliberately make their parental tools pretty confusing and hard to use. And so it is just unfair to expect parents to be able to counter these companies which are using psychological manipulation, which are using technology, which are using all of this data in order to deliberately hook our kids and often to show them content which is just frankly toxic. And so obviously parents have a role to play, but we need more responsibility from the companies themselves. And what we have seen after many years of this experiment on our children is that the tech companies are not going to change on their own. And so that leaves regulation as really the only answer if we want these companies to change how they are designed. And again, we cannot do this just through better parenting. And the other thing that I would say is that parents face a really unfair choice right now. You can try and keep your kid off of social media, and you would have many good reasons to do that because of all the toxicity on social media and because of the addictive nature and because of all the harms. But if you do that, you are isolating your child from their peers. And as children reach adolescence, the most important thing for them is to be with their peer group. And so parents face this terrible choice. Do I want my kids to be online with all of this harmful content and to become addicted? Or do I want them to be isolated from their peers? And so that's a terrible choice for parents. That's a terrible choice for children. And so we need to create help these companies create safer online environments so we don't have that choice, so that parents have good choices instead of choosing between two terrible ones.
Josh, we've got a question for you that came to us on text from Mike in Keyport, New Jersey, who says, can you address the latest Supreme Court ruling on internet content? And why would children be different?
Sure. So there's. Let me see the best way of explaining this and quickly. So the Supreme Court. So basically, social media companies are not liable for content that users upload to their sites. And that is something that the Supreme Court, there was a recent case that they were deciding, and they kicked that case back to Congress and said that Congress should really be the one to decide this. We don't think that, so basically, I understand why companies wouldn't be responsible if I post something to their site that says, kids, you should starve yourself. But what we think the company's responsibility should come in is when that company starts promoting that content to kids. There's a difference between that content just living on a site and it being actively pushed to kids as a way to keep them online longer. So that's one of the big questions that's going to be decided by some of this legislation and perhaps by some of these court cases is, are these platforms actually responsible for the deliberate design choices and the ways that they're using to addict kids? And are they responsible for that? I think the clear answer is that they should be, but that's something that the courts and Congress are going to have to decide.
And I'll just put on the screen the recommendation for technology companies from the Surgeon General. And it says this, that technology companies can better and more transparently assess the impact of their products on children, share data with independent researchers to increase our collective understanding of the impacts, make design and development decisions that prioritize safety and health, including protecting children's privacy and better adhering to age minimums, and improve systems to provide effective and timely responses to complaints. Here is Margaret, who's calling from St. Augustine, Florida. Hi.
Hello. I understand that in order to make money, you emphasize so much how Meta is making money from this, even on a site that's talking about food disorders, because you could sell a product. But for sites that are teaching children to choke themselves or do other harm, how does Meta make money from it? There's no product to sell. And how 14 and 15-year-old children, wouldn't they have to have a credit card to be spending money on these sites for someone to make money?
Josh?
Yes. So these sites make their money through advertising. So the longer a child is on a site, the more videos they watch, the more they interact with other users, the more time that they spend, the more advertising the sites can sell to be delivered to that child. And so the way that they make money off of the choking challenge is that the choking challenge, it turns out, is very good at getting kids to watch videos. It's very good at getting them to spend more time on a platform. And so they push the choking challenge out as a way to get kids to spend more time on the platform so that they can deliver more advertising to that child. So it's all about delivering kids eyeballs to the advertisers, and they do it by any means necessary, including by serving toxic content in order to keep them on longer.
All right, Alfonso is next in Broadnex, Virginia.
Yes, go ahead. Hello?
Yes, good morning, Alfonso. You're on the air.
Yeah, I think that it is ridiculous that kids use cell phones because they say cell phones are babysitters. You tell a kid when they get home from school, I don't have time going to the room and talk on the cell phone. And they go and talk all they want about nothing.
So, Alfonso, you're a parent. Do your kids have cell phones?
No, they're too old to have anything else. I don't have kids. I have grown children. I'm like 87 years old.
All right. So you're just saying don't give kids cell phones at this point?
Don't give them cell phones. They got children coming in the food markets and they give me my cell phone. I want to talk to somebody, and there's no parental guidance with that.
All right, Josh, what do you think? Is that realistic?
So I think for younger children, yes, don't give them cell phones. And I think, my advice to parents is always to hold out as long as you can before giving kids their first smartphone, because that is going to change everything. Once they get that phone, it's going to change the way they interact with their peers. It's going to change the way they think about themselves. It's going to change the way they spend their time. And so waiting as long as possible is advisable. And I hope parents do that. Having said that, kids do not live in isolation, and particularly as they get older and get towards high school, to not have a cell phone means being isolated from your peers, and that is a very hard decision. For some kids, maybe that is the better choice. For others, it may not be. But that is one reason why we need to change the media environment and have safeguards and policies and regulations to protect kids and to make this less addictive and less toxic, is because, again, We can't expect parents to deal with this all in isolation because kids live in a culture, and if every other kid is on a cell phone, even if my daughter doesn't have one, cell phone culture is deeply impacting her. So we need to change cell phone culture and not just say, parents, don't get your kids a phone and all of this will go away, because our kids live in a youth culture that is very much online these days and very much phone oriented. And again, doing this in isolation is not enough.
But Josh, what do you mean by changing cell phone culture?
What I mean by changing cell phone culture is, I think there are things that communities can do. There's a great pledge. It's called the Wait Until 8th Pledge, where families pledge together in a school not to get their phones. They have to get their kids' phones until 8th grade. And then all of a sudden, that's a game changer, right? When your kid comes to you in 5th grade and says, Mom, I'm the only one in school that doesn't have a smartphone, you can pull out your list and say, well, actually, I know for a fact that there's 15 other kids that don't have cell phones. And not having a cell phone doesn't make you an outlier and an outcast, because there's a whole culture of kids that don't have cell phones. When kids go to places like sleepaway camps, they're so much happier because the camps take the phones away and they don't even have it as an option. So as adults, creating cell phone free places for kids, working with other parents to delay getting cell phones, those are things like community-based solutions that I think work so much better than trying to do this in isolation. Because again, our kids we're not their only influences. They are deeply influenced by their peers. They're deeply influenced by the places their peers are hanging out online. And so the more that we can do this together as parents, the better. That works better, though, when kids are younger and we have some more control over what they do and who they're hanging out on. As they get to be older and teens, that can be really hard. And that's another reason why it's so important that these platforms have safeguards and are designed with kids' best interests in mind, rather than just being designed to make money off of kids.
Okay, West Lafayette, Indiana. Zachary, good morning.
Good morning. Thank you for C-SPAN. Just a few things. One, I can't help but be reminded that some of these arguments about parents not having enough time sound similar to the PMRC hearings and how parents didn't have enough time to follow the music that their children were listening to. But I really think the guest is proposing a false dichotomy on the isolation component. If we're trying to have children engage in meaningful relationships with each other, what better way to do that than offline, and make sure that we're providing that opportunity as parents, as neighbors, as a community, to make sure that children can actually have meaningful relationships outside of the screen, whether it's in our homes, on our streets, in our parks, and around that way. And then two, I'm very tech savvy, but in that regard, if parents are ignorant on how technology works or how parental monitoring systems or observation systems work, it's very easy to get trained up on that. So it sounds like that's an education issue. But probably the most important component is making sure that you're raising children to be resilient and critical of the world around them and not be victims just to peer pressure or societal whims or fads and that sort of thing. And then finally, I see a lot of similarities between a food diet and a media diet. And so just because everyone's peer group might be eating fast food, that doesn't mean that your child also has to eat fast food. And so we need to be very critical of the consumption of media that our children have, and so that they have the tools to evaluate what is would be considered a healthy media component and an unhealthy media component. Because just like food, there is junk media, and let's face it, a lot of the content that's posted on social media is of the junk variety. So I think if we empower our children to be critical thinkers and resilient to those kinds of influences, the world will be much better off. And this is more of a society problem and not a government problem. Government can't do those things to make children more resilient and critical. That's the job and responsibility of the parent, the community.
All right, Zachary, got it. Josh, any comment?
Sure. I certainly, agree that as communities we should be doing more to get our kids offline experiences, and that we should help get our kids become critical thinkers. But the fact of the matter is that adolescence is a time of rapid brain development. Kids are impulsive. They're very susceptible to peer pressure. This is just part of their natural development. And as long as the majority of teens are living online, and these are the spaces in which the social drama is happening and the relationships, and like this is where all the action is, it is understandable that kids are going to want to be where their peers are. And so expecting kids that we can equip kids with the critical facilities in order to completely resist this manipulation that goes on when these companies are, doing all of this testing to figure out which of their features are going to manipulate kids into staying online longer. Collecting so much data in order to understand what is the content that kids are going to be most vulnerable to. Using tricks like, using the fact that kids want to be popular, that they want to emulate their peers, using that against kids in order to keep them online longer. These are things that are just fundamentally unfair. And so, yes, we need to give kids more critical faculties so they understand and they have more ability to resist, but we also need to make it easier to resist. Right now, the companies, what they're doing is designing these platforms so that will keep scrolling and scrolling and scrolling without thinking about what we're doing. And we need to create more friction on these platforms so it is easier to break away and activate those critical facilities. And that won't happen just by educating kids alone. We need to educate kids, we need to educate parents, but we need to make these platforms safer and less addictive too.
All right, Mary is calling us from Wisconsin. Good morning, Mary.
Good morning. When we moved here, my son was a freshman. He was the only boy in school that didn't have a phone, so I gave him my flip phone for sporting events. And so there's no reason why kids can't have flip phones, and parents need just to say no. And kids also, I don't know who's in charge of having computers and tablets in schools, but the first thing teachers do is hand you a tablet in elementary school. It's because it's like a TV. It's less work for them. Teachers have control of what's going on in school, and if they would be hailed heroes if they took away computers, and only allowed flip phones in school. Also, it's the parents that need to say no. I have an experience where my daughter was a freshman, went to a friend's house, and I raised them without computers. She didn't know she had to log off when she was talking to a friend on the phone on the computer, and the boy online said, "This isn't Erica anymore, is it?" And it wasn't Erica. It was another girl that was saying this stuff that was very wrong. And I didn't raise my children that way, so you got to keep your kids away from sleepovers. And it is truly the parents' responsibility to say no. You see a computer, you don't go to that house. More houses would not have computers because people will want to have their friends come over.
So, Mary, I want to show this. This is from the Surgeon General's op-ed that he published in the Washington Post. He said this: for too long, parents have borne the entire responsibility of managing social media use. Certainly there are steps parents and their children can take to set boundaries, but they shouldn't have to do this alone. Most social media platforms are designed to maximize user time and engagement so that ultimately teenagers and their parents are pitted against some of the world's most talented engineers and product developers. This is not a fair fight. In contrast, manufacturers of physical products, from medications to car seats, toys to cars, are required to meet safety standards. Consumers are not expected to evaluate the safety of these products on their own. The same should be true of social media. And let's fit in Leah in Hartsville, South Carolina, real quick. Leah?
Hi. So good morning. So I've been a middle school teacher, taught 8th grade for 10 years now. And over those 10 years, I have seen more and more and more of my students having cell phones and having social media. And because of that, we have also seen an increase in suicide rates in our youth. And that alone makes me think, as a parent to 2 younger children, that I do not want my own kids to have access to cell phones with capabilities of going onto social media. And also, I will say that there are a few, not many, but there's always a few kids every year that don't have cell phones. And those are the most well-rounded, respectful, just all-around good kids that have those good social skills and know how to talk to their peers and not be easily influenced by peer pressure. And like I said, it's just one of those things where I have seen over the years, every year we have suicide risk go up and up and up. And I think part of that has to do with social media.
Okay, Leah, let's get a real quick response. Josh, last word.
Yeah, I think we've heard from 2 teachers today calling in and what they're seeing in their classrooms. And I think we should listen to people who are on the ground and who understand not just what's happening in their own household, but how this is affecting whole cohorts of children. We need to change the way social media is designed. We need to treat it like, as the Surgeon General said, any other product, and have basic product safety rules around social media. We need to make it less addictive, we need to make it safer, and we need to help kids get the offline time they need to thrive, and that won't happen unless Congress acts this year.
All right, Josh Golin, Executive Director of Fair Play. They're online at fairplayforkids.org. Josh, thanks so much for joining us.
Thank you for having me.
And still ahead on Washington Journal, Associate Senate historian Catherine Scott discusses the history and legacy of the Senate Watergate hearings, which happened 50 years ago. But first, we'll hear from more of you during Open Forum. You can start calling in now. We'll be right back.